Are you experiencing a stiff, tight lower back? I'm Dr Kez, Doctor of Chiropractic, and this is my wife, Em. No, she's not a sumo wrestler, although she does look a little like one. Together, we're Dr Kez's Chirolab, and we're helping you to heal at home. Today, we're taking you through how to use a cupping set to help alleviate tightness in your lower back that can lead to some nasty pain. This is simple as to use. In fact, we've got some of our patients who use this on their parents, like young kids, 8-year-olds, for example, that can use this. So don't fear, it's not as difficult as it looks, but you get some really amazing results. When our lower back becomes stiff because of muscle tightness, there's a couple of options for you. You can stretch, challenging area in the lower back, I'd have to say, or you can use things with a practitioner like going to get dry needling or massage and things done. In this case, what we're going to use today is a cupping set, because when the muscles of the lower back, and there's multiple layers of muscles in your lower back, become tight for a long period of time, they actually stick to one another. There are some muscles in here that are responsible for tilting your body to the side. There are others that are responsible for flexion and extension. When those muscles all stick to one another, when one contracts, all of these movements happen at once and it becomes paradoxical or an unusual movement for that area. We don't get the normal mobility in our lower back, which leads to a lack of blood flow, which leads to accumulation of all kinds of inflammatory responses and toxins, and then it leads to pain. So we're going to show you how we can use the cupping set to break up those adhesions. The cupping is the best way that I know in all of my clinical experience of over 20 years to be able to make sure that we break up those adhesions. Even the dry needles don't manage to break up the adhesions. This is the best way to be able to do that. So first of all, what we're going to do is we're going to apply the oil. It is really important to have an oil lubricant between the surface of the skin and the cup. It allows the skin to slide nice and easily up into the cup without any discomfort, and it helps to relieve any type of toxicity you have in your body, which cupping is really good for as well, and it increases the blood flow because of the essential oils that we've chosen to pop in. So I'm going to start with warming up the oil, of course. Don't be cruel. Don't make it cold. So just making sure that the area is covered, and as I said, it's actually really good to be able to warm up the muscles before we do our cupping set treatment as well. Now I have exposed Em's behind because the muscles that we really want to deal with when it comes to lower back pain include the glute muscles as well as the erector spinae muscles, which are the muscles that are up that top area as well. So once we've done that, we can choose and select the appropriate cups that we're going to use. This is what the inside of your cupping set looks like without the handle, because I've got it ready to go. What we want to look at is the area that we're going to be cupping versus the size of the cup that we can use. There are some really big ones in here, which can work quite okay for a glute area, but on Em, who has got really strong muscles along her erector spinae, we need to choose smaller cups to make sure that we get a good vacuum seal. So we're going to select the 3s for Em. I'm going to get 4 so that we can have 2 on either side, here and here, on either side. And we're going to select the 2s, and we're going to do one up nice and close to the SI joint, which is where the sacrum and the pelvis meet, and then the other one we're going to do further down, which is going to incorporate the piriformis muscle. That one's a nasty one if you've got sciatica. We're going to include that in both. You can literally cup all over the buttock if you like, but those are the 2 critical places that I want to make sure that you do get in your cupping set. Now, in the cupping set, there is also some magnets. I'm going to show you how to apply these. You don't have to use these, you can cup without. The instruction manual will talk you through all of the different things you can do with the cupping set, including breaking up adhesions. There's slide cupping you can do. You can do cupping on the face that's like an on and off cupping so that you don't end up with a mark, like a cupping kiss as we like to call it. And there's also places that you can use the really thin, small cups to stimulate acupressure points. When you apply the magnets, you're including an increase in blood flow more than just using the cups, because the magnet will attract the heme or the iron within your blood, creating that extra bit of circulation for you. So given that we've got an area that's tight, if we can increase the blood circulation, it's going to really help with healing. So I'm going to place all of the magnets onto the cups. Don't use the magnets on the really little thin ones that are under the handle. I'll show you how little they are, because once you've got them on there, it's really hard to get them off without using tweezers or something. So try and use them only on the larger ones where you can get your fingers in nicely. So once again, the magnets are for increasing blood flow, so you might as well use them. That's my theory. Increasing blood flow means increasing healing. Any type of area that's tight and stiff is lacking blood flow. We need to encourage the blood flow as best that we possibly can for that area there. All right, so first of all, finding the cups that are going to appropriately fit, we need to make sure that they have a good suction to be able to get the effective pressure that we require. Now, this is a new cupping set. When you first get your cupping set, you will find that the little valves are quite stiff. So I like to pull them out before I start, because otherwise if you pop one on and go to pump and you can't get any, don't force it. It's because it is sealed from the manufacturer's seal. So please make sure that you do that first. So I'm just going to check these. Perfect. All right, so when I'm doing this to someone else, or when someone else is doing this to you, they can just use the handle directly onto the cup like this. I like to do a little bit of a sneaky oil of the handle because it makes it so easy to then pop on and off. If you're doing it to yourself and you're wanting to place them on your lower back, we have an extension tube in this set which attaches to the handle and then to the cup. Again, give it a little bit of oil lube inside, because it then pulls off nice and easy, which means Em would be able to do this herself with comfortably pumping from the front of her body so that she's not twisting. It's a really good way to be able to use it on yourself. But for now, Em's in luxury land. I'm actually going to do the treatment for her. So I always find that it is helpful if you can get someone else to do it for you, because I feel that you've got that opportunity to really lay down and relax and be able to get yourself into a nice neutral position. Try not to lay down on a bed where you're twisting your head off to the side. We're on a massage table here. Em's got her head straight down. If you're only at home and you've got only a bed to use, for example, maybe move yourself to the edge of the bed so that your head can lean over the edge of the bed so that you're not twisting your spine, because that will affect what's happening in your lower back. If you've got a disc problem, please place pillows underneath your pelvis so that you can get a nice arch like this, so that your lower back isn't in that curved position for too long, because that can aggravate things as well. We don't want to make anything worse. We want to make things a whole lot better. So we're going to start low. I know I've just done a couple of pumps, but it is really dependent on what area you're doing it on and the tolerance of the person that's doing it. If you've never had cupping before, a couple of pumps might be too much. In some areas, half a pump is all that you need, okay? Remember, you've got this cupping set for life, right? So you can do a treatment in a couple of days' time. You don't have to get it all unadhered all in one sitting. I recommend using this particularly over the muscles. Don't do it over the bones. It's not that effective, and you will find that it is not going to give you the results that you want. We're trying to break up adhesions to get it right over the top of the sore muscles that you're trying to unadhere or break down those adhesions. All right, so how are you travelling there?
Pretty good.
Nice to be pampered, isn't it?
It is. I love the feeling.
Sorry you can't see these ones on this side. If you've got any moles or anything like that on your body, try and avoid those. We don't want to cause any damage to the skin. If you've got any cuts or abrasions, try and avoid those with the oil. If you're wanting to do a quick and easy trick with the oil, we also can just use the oil. I use a little cotton ball and I just squirt the oil that comes with the cupping set, is a little squirting bottle, onto the little pad, and then you can roll it on and just apply it. It will work the same. I do like to make sure we give a nice little massage to begin with to be able to get the blood flowing, and it certainly is a great way to help increase healing. As I mentioned, the oils within that special oil, the active ingredients, the essential oils within that are actually really good at being able to assist with healing. One of the things I would recommend is make sure that you've got yourself some wet wipes or a washer afterwards, particularly to be able to wipe the oil off. It's just a nicer way to finish your treatment, and you can then clean the inside or the rim of your cupping set to put it back into your set. With a treatment like this, I would leave the cups on for about 10 to 15 minutes. If you're used to having cupping and you fall asleep and you're there for half an hour, it's going to be to no detriment. Certainly is going to really assist. If you've never had a treatment before, the first couple of minutes when the muscles are still adhered to one another is quite intense. And so once those adhesions start to break down, you will feel it almost feels like the pressure of the vacuum has decreased. It hasn't. It's just that muscle underneath has let go, and that allows that increased blood flow to that area. And that's why we want to make sure that we're there for a good 10 minutes after that's happened to make sure that we're getting the blood flow into that area. Imagine for a moment a muscle that's really tight, has been really tight for a long time. The blood just can't perfuse into that muscle, and as a result, we end up with all sorts of ailments that can't heal properly because we're not getting the nutrition we require and the blood flow that we require to be able to actually heal those areas. That little lactic acid gets stuck in those muscles, and as a result, you end up with quite a bit of discomfort in there. So once we break down these adhesions, particularly once we take them off, it's like heaven, so good. We've got that opportunity to be able to increase the blood flow. If you're wanting to do slide cupping in this area of the spine here, we only need to use minimal suction pressure to begin with. You must make sure you do the entire area with oil before doing slide cupping, as opposed to just doing the rim as I mentioned before. And then very minimal pressure, just enough for it to grab in suction, and then you gradually glide back and forth over the muscle. Please don't go over a bone, it will be uncomfortable. Back and forth. As you do that back and forth without the magnet inside, make sure there's no magnetic tip inside, you will find over time it will start to create a response in the skin. It will become red. There can be little petechia, which is like little dots of red in that area, which is a sign that we're getting lots and lots of blood flow in that area. It's a great way to break up fascial adhesions, which can also contribute to some significant back pain. But that's it. It's as simple as that. Get your timer on, lay down with your head over the bed, reading a book, checking Facebook, whatever it is that you want to do, and then you can pop those cups off. Like I said, we like to use a wipe afterwards on the cups, and also a nice warm washer of water, which I've prepared earlier. There is a chance it will be cold, so we'll see by Em's reaction, and then dry everything off so that they can go back to it. If you've got some of the Chirofix injury relief lotion, once you've wiped all the oil off, I would apply that. I find that's a great way to provide the building blocks for repair right in that area where you're experiencing discomfort. For any of the products that we've mentioned, including the cupping set, feel free to jump down and click the links below. That will take you straight through to give you some more information about what you can do with these particular items like the cupping set. It will also show you what's in our Chirofix injury relief lotion, which is one of our own products that we've made after years of clinical experience with our patients and working on being able to help reduce any type of soft tissue inflammatory condition and pain as best that we possibly can, so that you can recover faster. That's the key. We want you to be back doing the activities that you love, whether that is working, chasing after kids, back on a sporting field, whatever it is that we can do to get you back so that you're feeling 100%. That's what we're all about. So let's show you how to take them off. It hasn't been 10 minutes, but that's okay. Em gets treatments all the time. So we just pop the valve. Sometimes the cup will pop straight off. Sometimes we need to place a finger and break the seal as well. As you can see, there's a little bit of a petechial response there, which is really good. I'm just going to use my wet washer to be able to clean those before I put them back. If you have somebody else doing this for you, don't forget to offer to reciprocate. That's the benefit of having something like this in the household, is that you can share it around. Love the opportunity to do that. The different colours that can occur in your cupping kisses are indicative of what's been happening in that area, particularly a stagnant blood supply. If there's not been a lot of blood supply due to that tight muscle that we spoke about a moment ago, it will become really rich in colour, and that's a sign that your body really needed to be able to have those adhesions broken down to be able to increase the blood flow, so that's a good thing. If you start doing this more regularly because you've got the set at home, you'll find that the colour will be less and less, and that's because already there was a decent amount of blood flow in that area, so it's a good sign. M's are minimal because we've only had them on for a couple of minutes, and of course I look after her well, so that's a good thing. No comment. Oh well.
You certainly do, babe.
All right, piece of cake. So once we're done, we get rid of the oil. Yes, it's cold. Sorry, it's been sitting for too long. Ooh. Dry it off. Nothing worse than being left with cold on you. Em's been using a spiky ball. I don't know if you can see that from there. She's been treating a hamstring issue and been rolling on a spiky ball. Looks like she's got some sort of weird disease. And then just apply some Chirofix onto the area. Anything we can do to assist with healing. And it's literally that simple. So good to be able to get these type of professional results right there in your home, and you can use them whenever you get a niggle. Great opportunity to be able to fast track your healing. Thanks for having us on your therapeutic journey.